The topic for today's discussion is trachea. So, what is trachea? Trachea is a mobile, cartilaginous, and membranous tube. As you can see from this picture, this ringed structure is the trachea. The extent of trachea is such that it starts from the cricoid cartilage. This ring-shaped cartilage is the cricoid cartilage, which lies at the level of cervical 6 vertebra, and it goes down in the midline and it bifurcates at the level of thoracic 4 vertebra. This point of bifurcation is called the carina. The trachea divides at T4 level, also called the sternal angle, and it divides into two main bronchi, the right principal bronchus and the left principal bronchus. So, the trachea, which is a cartilaginous tube, extends from C6 vertebra to T4 vertebra and divides into two principal bronchi. The structure of trachea is such that it comprises of C-shaped cartilages in the front. The gap in the C is filled by trachealis muscle which lies on the back. It means the tracheal cartilages, C-shaped cartilages are in front and the trachealis muscle is in the back. In this picture, we can see that this blue ringed structure is the trachea, starting from the level of C6 and extending till the level of T4 and bifurcates into right and left principal bronchi. The relations of trachea are on the posterior side we can see that behind the trachea is esophagus and the left recurrent laryngeal nerve. Anteriorly, we can see the arch of aorta and brachiocephalic artery, left common carotid artery, and the left subclavian artery originating from the arch of aorta are also making the anterior relations of trachea. In this picture, we can see that on the right side of trachea is the brachiocephalic vein, the azygous vein, and the right vagus nerve. And on the left side, we have the left vagus nerve, the left phrenic nerve, the pleura, and the arch of aorta. This is trachea and this is arch of aorta. It is turning towards the left side, so it is in the anterior relation of trachea as well as on the left relation. The blood supply of trachea is such that the upper part of the trachea is supplied by the inferior thyroid artery, which is a branch of the thyrocervical trunk of the subclavian artery. And the inferior part of trachea is supplied by the bronchial artery, which is a branch from the descending thoracic aorta. So blood supply of trachea is in the upper part by the inferior thyroid artery and in the lower part by the bronchial arteries. The lymphatics of the trachea drain into the pretracheal and paratracheal lymph nodes, and the nerve supply of trachea is through the two vagi and the recurrent laryngeal nerves. That's all for trachea.